So you're counting pennies and you need medical advice on whether to see a doctor. Well, you can find it online, but with some caveats. Jennifer Warren, health communication specialist and PhD from Rutgers University, is here to shed some lights on the benefits and the risks of doing just that.
How are you?
Good.
Thank you.
Let's talk about e-health. What does that mean?
Well, e-health generally means healthcare practice supported by electronic processes and communication. So we would look at things like electronic medical records, telemedicine, where medicine is done at a distance via TVs. And then there's also the internet, where we could access health information, some health interventions online. And that brings to question the e-patient who utilizes the e-interventions online. And then there are just other places you can go to gather information and research. Big portals like NIH, the National Institutes of Health, World Health Organization. There's lots of places you can go to get lots of information on a lot of different health issues.
So the internet's become a big equalizer in terms of providing information, medical information for people who maybe can't afford to go see the doctor, or they're weighing whether to go see a doctor. They can find out info there.
And that's interesting because when we say the great equalizer, the goal was to decentralize information with the development of the internet. But as the internet has gotten more and more information, it seems that there are some disparities in access to that information. For instance, the digital divide, where some folks have the connectivity in their neighborhoods, access to the equipment. And then there's also a divide related to getting information that addresses individuals' cultural, linguistic, and literacy needs. And then there's also a divide wherein health providers actually facilitate access to this information for their patients. Some can't. And this occurs more in impoverished areas, more working class communities where people just are not using the internet in that way.
Sure, or they don't have a computer in the house.
They may not. But let me just add something to that. There's lots of groups that aren't using the internet on a laptop or a desktop, but its growing use is in mobile technology, using the telephone.
Now, I understand. I saw an interesting study that showed that Black and Hispanic youngsters are using the mobile phone applications more, but using them for entertainment, as opposed to education and health care. And perhaps this is something that we can address.
Yes, and that's the issue with getting trusted stakeholders in the community and providers to really help outreach and show different communities of users that the internet is useful for other things than technology, than entertainment. And that is a continuing sort of endeavor, because there are lots of folks that use the internet or mobile technology for entertainment, aside from children, but they're not using it for actual health information.
Is this something we need to impress more upon parents?
I think so, but I think parents, in conjunction with providers, they need to get together and talk more about this at the table.
So then maybe the providers, your doctor's office is going to say to their patients when they come in, look, check out this app or check out this website, or promote those things in the doctor's office.
Providers, physicians are the most trusted folks to some communities, African Americans and lots of other different types of groups all around the world. And so if they could actually outreach with their patient saying, hey, like you just said, this site is a good site, I think the patient would be more inspired if they have access to go use it. And the health center should be having perhaps internet access there. Maybe some technology set up so that the patient could actually go use it in the health center.
Now, are there efforts that perhaps Rutgers or other entities that you know of are involved in making this increasing public awareness about this?
What's interesting, Brian, about this issue is that there's more concentration, I think, on electronic medical records being developed, as opposed to actually developing resources for groups that may not have access to the technology. In my own research, I come across feedback for when I write grants or articles on this, where people say they're not going to use it, which is sort of a stereotypical sort of way to view it. They're not going to use it. Why are you building? Why would you want to build this? Why is this information important to us? But yes, technology needs to be available to all.
All right. Well, it's something certainly I would imagine your research is going to focus on getting perhaps universities to begin getting in on this process and other universities coming on board. But we'll have you on board to talk more about that as the weeks progress. But thanks for joining us.
Thank you very much. I appreciate it.